I'm Dr. Akheel Rizwan. I'm a pediatric intensivist and a pediatrician at Rainbow Children's Hospital, Vikrampuri, Karkhana. Um, Thank you, first of all, for this lovely opportunity provided by DPS Secunderabad to address on COVID-19. Um, I hope you're all doing well. I hope all have been safe and healthy at home in the last 60 days of this crisis that we are going through. My best wishes for your health and well-being. In fact, I just spoke to our principal, Mrs. Shailaja Gopinath, like 5 minutes before I started this webinar. And the intent of doing this was not to have a one-sided presentation. My thoughts were that we should do a two-way discussion as to how Rainbow and school can collaborate in providing more and better information and collective efforts in handling this kind of crisis. Unfortunately, you're not able to see, you can see me, but I'm unable to see you all. Um, but I would look forward to having your questions coming on the side so that I can make it as a discussion base rather than having it as one-sided conversation. So when the purpose of today's meeting is to see how and what guidance we have when the schools reopen. There is a lot of unknown right now. We are not aware of what is going to be the situation in the next 2 months. But yes, that we have to have certain guidelines in place as to what we should be doing when we open up schools. I don't know if, or maybe everyone is aware of the fact that the WHO and the Indian International Federation of Red Cross and Red Crescent have issued a guidelines in March 2020 as to what should be done with school reopening and how the teachers and the other caregivers be involved in situations when we open up the schools. So for me, primarily the purpose of this today's meeting was to provide a clear, actionable guidance for safe operation through prevention, early detection, and control of COVID in schools and other educational facilities. The other purpose was, to have this session with the teachers was because today's children are, and the young people are the global citizens of tomorrow, and are a powerful agents of change for the next generation of caregivers, and doctors and scientists who will be one of all these. So it's important to involve them in this present crisis and provide them an opportunity to help and let them learn and cultivate compassion and increase resilience while building a safer and more caregiving community. So with this, I move ahead, and I'm just looking if I have any questions from your side. Well, we still not have any questions. So basically, as I said, WHO and International Federation for Red Cross has issued a guidelines in which they talk about understanding what COVID is. We've all understood what COVID is. I mean, you ask my 8-year-old son, he will say what COVID is. But I think what's happening with the information that we all have right now is it's more of a media-based or internet forwards, which is coming in, in various forms. I think schools can do a fantastic job in sort of providing a uniform information on this subject. Like, the school should have one information that says, COVID is this is how it is acquired, this is how it spreads, and you spread that uniform information to a child, and that child takes that information back to the family. And if we can spread that information to 5,000 families in one go, and then it brings about uniformity in our beliefs and practices. So, so what is COVID? We all know it's coronavirus 19. How does it spread? It spreads by droplets, by contact from human to human. What are the signs and symptoms? It's fever with cough and breathlessness. And uh, what is the treatment for it? Nobody knows what the treatment is right now. We don't have any vaccines right now. So there's a lot of unknown about this, but all what we know is how do we prevent it. We should not stigmatize, certain groups or certain societies. This is a message which school can take forward, and I think the biggest responsibility is going to lie on schools and teachers in the coming days, because no matter how much we have collectively gathered information as an individual family, but what a teacher can convey to a child and the child takes that information back home is the most significant mode or model of preventive care in terms of hygiene and in terms of controlling this pandemic is what my feelings. And I think you will also agree with what I am saying right now. So that is a little background about COVID. I'm sure we all know about it. So the WHO and the um, uh, thing says that you should stay home when you're sick, covering the mouth and nose, washing hands, cleaning frequently untouched surfaces. This is what the basic information they have. They want to drill into every school, but they have laid out a certain key message of actions. I think if you Google a document called uh, you will find it on the internet by the WHO and International Federation of Red Cross. So they say the basic principle is that the sick students, they have given around 4 or 5 subtopics on which they have classified as to what the school should be doing. So they say is that there's a basic principle, know the latest facts about, for teachers, this is for, know the latest facts about the disease process, ensure the schools are safe in operation when they are there, establish procedures in students or staff become unwell. If the staff and students become unwell, you establish procedures, promote information sharing, and adapt school policies where it is appropriate. So again, under this, they have now given a detailed description of what is to be done. So primarily what it says is, I'm reading it out as I'm looking into the document, I'm just reading it out. It says six student teachers and other staff should not come to school. Schools should enforce regular hand washing with safe water and soap, alcohol rub, hand sanitizers, and chlorine solution. Schools should provide water, sanitation, waste management facilities, and follow environmental cleansing. Schools should promote social distancing. This is what the basic principles they have addressed. And knowing the facts about coronavirus, follow reliable information from the WHO or the Indian government, which is declaring. So you have to keep yourself updated because nothing is going to remain the same. The pandemic keeps changing and we have changing situations. So that's what they say. Ensure safe school operations. So they talk about, the document talks about, having lesser stringent rules on absentees and exams and those kind of things. So that's the document. If you Google, you have everything enrolled on that. So my suggestion to the schools or the teachers would be like, you have to protect yourself wearing appropriate protection masks. And before the school starts, if you're all deciding to do a webinar or you're going to involve the parents, then you should stress on the fact that information is provided to them before the school reopens. So my suggestion would be like if you are starting to plan to open the school, I'm sure you will be having some telemedicine teaching and those kind of things. In that, to stress on doing a drill every day, like a 15-minute session like you would have in an assembly, where you would stand and you would say a school prayer, and then you have a session there in an assembly of 15 minutes like a drill Like every day you do this, you wear your mask, you hand sanitize, you have techniques of social distancing. It is going to be very difficult for teachers and schools, because the primary school children uh, is one where up to fifth standard, it's very difficult to keep them social distancing away. I really don't know how uh, schools are going to manage. It's a humongous task for teachers and schools. So on that note, I think I would like to take some questions right now. Is there anybody who wants to post a question? Hello? Yeah, okay. So there's no questions so far. I can't see any questions on the screen. So like my son's school is opening on the 8th of June. They have it's not opening practically, but they're doing online teaching. So what the school has suggested is there will be 5 periods in a day. Each period online will have 45 minutes period and then 15 minutes break. Then 45 minutes period, 15 minutes break. So this is going to be online teaching. So what if you are planning to do the same kind of things in DPS? What I would suggest is that you incorporate a drill in the daily teaching session of 15 minutes, that uh, where you religiously do the preventive measures, um, uh, practice the preventive measures, like wearing a face mask, hand wash, uh, social distancing, and those kind of things. So, well, this is what I basically wanted to say, and it covers around 15 minutes of my talk, I suppose. But I would be more open to discussion with questions. If anybody wants to ask any questions, please. So the discussion is always better when it is a two-way thing, because in terms of the document that is there, WHO's which precisely explains to you everything about what the laid guidelines are. And is there a question there? One second. Is there a question? Where do I see for questions? Questions, right? Okay, there. Okay. Oh, finally, we have some questions here, I think. It says, um, how do I read this question? Just one second. Oh, yeah. Thank you so much. I mean, there are a few questions over here. Okay. So, okay, thank you so much. There are a few questions that have come over here. I think this makes it more, live interactive, rather than me having to just keep talking about. So it says, hello, doctor. Good afternoon. That is, good afternoon to everyone once again. So there's a question by Ms. Suma Banerjee, who is asking, we have heard that some of the people are asymptomatic. So how do we deal with this? Ma'am, this is a question which is a very important question, and you are going to have all your children who are coming to school who are going to be asymptomatic. Most of them are going to be asymptomatic, because children are potential carriers. They do not, they do not show their disease. They may have a little bit of a sniffly nose. That's about it. They may have temperature. But the question is, yes, there are going to be majority of people who are going to be asymptomatic, and we are not going to pick them up, and they are going to spread without having any symptoms. And it is very difficult to identify these asymptomatic carriers. and children are the ones on the lead with this. What I would suggest is how, rather than identifying them, because it's not possible to identify them, we rather take precautions by maintaining social distance, by washing hands. You have to stay at least 3 feet away from a person anywhere you are in. I don't see that happening. I go to Ratnadeep, it's still crowded. People are still falling on your shoulder. I go to a medical store, people are still falling on your shoulder. So when grown-ups are not able to do it, you can imagine what kind of difficulty you possibly will have when you have children coming back to school. And this corona is not gone just now. It's going to be staying here with us, WHO says, for more than 2 years, and that's not a small time that we have to deal with. But yes, with your involvement, with schools' involvement, I suppose we can spread a better message to families, because children. I've seen my children when they come back home from school, they say my teacher has said this, and I'm going to do it this way only. So when 5,000 children go back to their homes and tell their parents that we are all going to do it this way, I'm sure that will bring a bigger change in families. But yes, it is very difficult to identify asymptomatic patients. There is the only way is testing, and we are not adequately testing either. So what people are doing abroad is they are testing everyone, symptomatic or asymptomatic. So that's how you identify. But in our system, with a country of 1.3 billion, I doubt we can do so many tests. So it is going to be a little difficult in our population to identify asymptomatic carriers. Yes, it's a repeat again, but we could possibly just take precautions from our side. Thank you, Mrs. Suma Banerjee, for that question. Next is Narsimha Rao, sir. Very good afternoon to you. Mrs. Shailaja Gopinathan has put in a question. Doctor, when they say 50%, I have heard someone say that on one day we will call grade 2 and on another day grade 3, for example, but we think that it should be 50% of students in a classroom. Well, ma'am, I think it's a very good thought. 50%. I mean, I don't know what your class strength is, but yes, if it is a strength of 50, 25, uh, people should be all right in one classroom, I suppose, taking care of, you know, sorry, yeah, sorry. Yeah, I know ma'am is going to be. Thank you. Okay. So sorry, ma'am, just got a little distracted. Yes, 50% should be a good number, I suppose. The document which WHO has released, it says that as long as you're maintaining adequate distance between it's going to be very interesting for us to see how you it's going to take on this mountain. Um, Also, what? Sorry, I think I've left a bit of your question. The second question by Principal Ma'am Shailaja Gopinath is that also what are the detailed materials to be kept ready when children enter school at the very entrance? Right, ma'am. There's a very good question again. What material should be available at the entrance? I think you should have a thermometer, a digital thermometer, which will record a child's temperature. You should have a sanitizer available. In fact, even before entering the school, before entering the bus, this should be, but this is a thought that you probably will have to put in, because you are going to have school buses that are going to operate. So you are going to have, the school starts from school bus, and checking Sir, please share the name of the document or share the link of the website. Ma'am, I shall do that. We will send you the link of the document to our principal, ma'am Shailaja. And I think that document should be given to every teacher, is what I feel. It's very, and it's got a checklist as well. It has a checklist. I didn't want to go through the document and put it as a PowerPoint presentation because I think this interaction is better form of communication than having just going through the PowerPoint of the documents. I will get that sent across to you, ma'am. I've made a note of that. The next question is again by Mrs. Suma Banerjee, who says, what kind of masks are suitable for children who will stay in school for about 7 hours? How often should the mask be changed if it is washable? But ma'am, it's a very good question again. Thank you for that question. I think it's going to be a task to make children wear masks. I mean, it's going to be one, but I'm sure teachers are the best people to make them make them do that, wear the mask and let them. I mean, make them learn to put the mask on. See, it's very difficult, ma'am. You and I know to put a mask and to breathe behind. Like I'm not having a mask now, right now, because I don't have much people around me. It's difficult to talk, communicate, breathe. So there is no protocol as to how often and how many hours it can be put on. We don't have an answer to that. But what I would suggest is tell your pupils in your school to wear the mask as much as possible. You reach in a, you're going to talk to someone, wear a mask. You're going to get in the closer distance of around 2 feet, please wear a mask. If you, so that's what I would encourage them to do. Washable masks, you could wash them, but what the recommendation is, if you leave the mask to dry air for 45 minutes to an hour, just dry air, that itself will have the virus gone off, or because the virus does not survive beyond 2 hours in dry air. So if you can put it in the sunlight for 2 hours or something like that, that should itself take care of it. That was a question by Mrs. Suma Banerjee. School, so children who will stay in school for about 7 hours, yes, ma'am. It's a question like I'm hoping by September, October, things are better and we will have more answers for this. But right now, I may not have the best of answers as to how long, but my suggestion would be use the mask as much as possible. Where is the next one? Yeah. How should the mask be disposed? Well, ma'am, right now we are just, leaving the mask to dry for a couple of hours, and then we are, you know, um, disposing it in our regular waste bins. And we should have the hospital has got a waste management uh, agency which comes and collects and throws it away. It is very important because when you have 5,000 children coming to school with masks and throwing everywhere, that's going to cause a lot of problem. So I guess you'll have to talk to a waste management agency. I will get to Rainbow and find out as to where we can source you that management agency. As what we are doing, maybe you could incorporate that into your policy, and that's how before leaving the school, maybe you ask them to dispose of in a certain place, or maybe they wear the same mask and go back home, and parents take the responsibility of disposing those masks at home. So with this question, I certainly will talk to Rainbow, and we will through Nagendra, and we'll make a little document for you saying that this is how we can dispose of the masks. So I'll get that answer to you, ma'am, in print. So the next question is, how about outdoor activities? There is a lot of stuff going around to boost the immunity.
Does deep breathing work?
One second, let me read. One second. Sorry, sorry about that. Coming back to where's the question now? Which is the question? The print is very fine, ma'am. I'm sorry, teachers. This one, right? How about outdoor activities? There is a lot of stuff going around to boost immunity. One, does deep breathing and pranayam really help? Or as and when the student gets back, the prime concern will be to give um, assurance to parents that their kids are safe. What kids are safe? Sorry, I think I've mixed up two questions. Let me just read back Mrs. Alka Mehta's question. Uh, Alka Mehta's question. There is a lot of stuff going on around to boost the immunity. One, does deep breathing and pranayam really help? That was Mrs. Alka's question. Ma'am, I think yes, a lot of outdoor activities are good for children, provided they are maintaining social distance. And deep breathing and pranayam, I think it should definitely be helping. There is no evidence as such right now to say, it has been proven to help, but I don't see any side effects of doing deep breathing and pranayam, right? So you could have outdoor activities for children, but provided you're maintaining adequate distance. Contact sports and swimming should be avoided. That is what the document by WHO says. But yes, I totally agree with Mrs. Alka Mehta, and you should encourage your children to do that. Maybe this could be, incorporated in your drill, the drill that you will do on a daily basis after your school prayer. That uh, so that it becomes a integral part of them, of these children. So the next question is by Mrs. Anupama Jha. As and when students get back, the prime concern will be to give assurance to parents that their kids are safe. What are some of these basic guidelines? How do I go down? What are some of these basic guidelines uh, to be adhered to a without much of a it's not going down. One second. Without much of a furor. Okay. But ma'am, very good question again, Mrs. Anupama Jha, or Miss Anupama Jha. I have had parents who have come to me and asked me in my clinic, and relatives and friends, as to what do we do with this year's schooling, and how do we cope with it, and because they have a lot of apprehension for sending children to school, because children are asymptomatic carriers. They are going to go interact with other children from various families, and they say that when the schools open, the spread is going to be faster, because that's what happened in France when the schools opened. The cases went up, so they had to again reshuffle the whole thing. So these children, they meet, they go back home, they're still asymptomatic. And we have families in India where you have parents and grandparents also living, and the risk is not for the children, and the risk is for the grandparents. If you have a diabetic patient in your house, if you have somebody with a heart disease in your house, if somebody is above the age of 50 in your house, with other comorbid conditions, and they have the risk. So there is going to be a lot of apprehension regarding school going and coming back. Well, the only way to reassure is you will have to involve, I suppose, the parents into this kind of exercise where you know you give them, you collectively call parents for some time and reassure them as to what all procedures that you've taken and put in place. Like for example, you could say we've worked out on A, B, C, D. We've got Rainbow in partnership with us. This is what we are doing. We check temperatures, we maintain records, we hand sanitize, we are maintaining social distancing. We want to do alternate day school. We want to do shift, whatever. This kind of repeated messages that go to the parents will probably reassure them. But there's no other way, ma'am, that you can tell them that your child has gone back to school. He's 100% not going to be a carrier, kind of thing. It's all right to be honest, I suppose, in saying that yes, they are asymptomatic carriers. We will take our side of precautions. You will have to take your side of precautions when the child is back home, making sure that the moment he reaches home, he does not go meet his grandparents. He hits into the bathroom straight. He leaves his footwear outside, leaves his bag in a certain place, goes into the shower, makes sure the shower is done, wears new fresh clothes, and then comes out and then only interacts with the family. So I think if these measures are taken, I suppose that neither the parents nor the grandparents, neither the school should have the fear that it's going to cause a bigger problem. Thank you for that question. The next question is Mrs. Rekha Tiwari. Good evening, sir. There are many myths um, regarding I suppose it's COVID. Rekha ji, that's what probably you want to ask. Yes, there are many myths regarding COVID. My suggestion would be, please do not follow just any blind myth. I mean, we're all people with knowledge, and we are the ones, especially teachers are the ones who are imparting knowledge. So you are the ones that you should rely on the most reliable source of information. ICMR, the Indian responsible body which is giving you the data, is the most reliable. I would rely only on ICMR as to what they're saying about COVID. WHO is there, and the International Federation of Red Cross and Red Crescent is the other body that will be giving reliable information. I would not rely totally on the news, WhatsApp forwards. These are the things that I think you should drill into your pupils' minds when you interact with them on online or when they come back to school for further education. So that question, I suppose, ma'am, was regarding COVID. There are a lot of myths, there are a lot of rumors, but just process the information uh, before you fall into a trap of these rumors. What about social distancing? How does school observe this social distancing? Again, that WHO guidelines there, ma'am. I will send it to our principal, ma'am, Mrs. Shailaja Gopinath. I'm sure she will be able to send you all a copy of that across to each one of you. It's a very small document, around 10, 11 pages. I'm sure if you go through that, it does convey a lot of information, right? But if you have as ma'am was saying, you could do school. Salisha ma'am was saying that you could do school half and one day, half on the other day. Yes, that is one possible way, but it's going to be extremely difficult because even in our hospital we have kept chairs at a distant, of more than 2 feet, 3 feet. But it's so difficult for people to follow. And the only way, I think, is not the grown-ups telling the kids, but the kids telling the grown-up. I think the reverse policy is going to work this time, because when I had a conversation with my child, a daughter and a son, and I told them and I taught them how to hand wash, I was amused to see, without any instructions, how he still has just fallen into that routine of hand washing. If I tell him, come on, wash your hand quick, he says, no, no, this is COVID time. He tells me that this is the way to wash your hand. You rub like this, you rub like this, you do all that. He does all these things. And I'm amused because no matter how much we teach the adults, it doesn't seem to follow. But I'm certain through schools, children will convey a better message, and the major role comes from teachers. The next question is by Madhuri Rao. Has left. Sorry. Okay. Sorry, Ms. Madhuri. She's left. Um, what is the difference between COVID-19 and influenza? It's a very good question by Mrs. Mamta Gulati. Um, she says, what's the difference? See, what does COVID stand for? CO is corona, VI is virus, and D is disease. And since it was 2019 November or December, it's 19. So COVID-19 is coronavirus disease 19. Influenza is a normal influenza, like para-influenza, a regular virus that has been there for generations now. You could get cough and cold with it. You could have a little sniffly nose, you could have some temperature, but your body has developed an immune system to it, and you can recover from it. The interesting thing about COVID and influenza is both of them have similar symptoms. A lot of influenza may be, which is there, and if the monsoons come, you can see there's so much of sickness with children. Our hospital at Rainbow is flooded with patients. So it could be just that it's influenza, but the scare of COVID is bigger because COVID is exactly like influenza. It causes fever, it comes with a little bit of cough and a little bit of runny nose. And then the worst thing about COVID is it causes breathlessness, and then it spreads from people to people and can kill some people. Influenza does not kill people, but COVID causes a risk to life. How do you differentiate between influenza and COVID? The only way to differentiate is by doing a test. And we do have testing facilities, and I'm sure the government is going to go easy on it, and private labs will have testing facilities available. And in the coming days, I'm sure we will all be able to walk into a lab and get ourselves tested for COVID. So if you have cough, cold, sniffly nose, do not panic for first 5 days or 7 days. You start developing shortness of breath in future. If the lab is providing COVID test, you go and get the COVID test done, right? And if you identified earlier with COVID, the earlier you reach the hospital, the better the results are. But with 3-4 days of fever and cough and sniffly nose, we don't know whether it is influenza or COVID, but you should not panic either. You should only panic when it gets into beyond 5 days and you're starting to develop breathlessness, and that's when you should seek medical help. Thank you for that question. The next question is by, okay, just last few questions left, I suppose. Can you just help me, please? Where is that? Where is it gone? Sorry for this. Where are we? Which question was it? Where? I'm not tech savvy, as you all can see, man. Okay, I'll just take a question from Mr. Hanumant Rao. Good afternoon, sir. Hanumant Rao, sir. When COVID entered in India, lockdown started 1.5. Lockdown started 1.5 lakhs. So many relaxation. How to understand this? Will temperature sensing device help? Okay. This is sorry. That's a different question. Mr. Hanumant Rao's question is: there were 1.5 lakh cases when. There were. So when COVID was in, this is what I understand from your question, sir. When COVID was in, lockdown was started. 1.5 lakh cases, so many relaxation. How to understand this? So it's a very interesting question because we have not hit our peak yet. Our peak for COVID is going to come mid-June or end of July. Sorry, mid-June or mid-July is what we are expecting our numbers to increase dramatically. So there is a calculation that says that we may hit around 10 lakh in numbers by end of June or starting of July. I may be wrong on this, but because these are all mathematical calculations that do not equate in a pandemic situation. But yes, the thing is, if we did not do the lockdown then, we would have probably had 10 lakh now. And if we had 10 lakh now, we probably would have had, I don't know how many more in the future by end of our thing. So I suppose the reasonable explanation why the lockdown happened when COVID entered was to prevent large numbers right now. So if you have 1.5 lakhs right now, they may become 10 lakhs in a month or in 2 months' time. But if we had 10 lakhs now, you could imagine what number would have increased in May and June. So I think lockdown by the government was a very sensible decision that was taken on the advice of the ICMR. I think we've done a fantastic job as a country, as a nation. By this, we've got down our numbers, and we will have lesser numbers when we peak in a population of 1.3 billion. And when we have lesser numbers in another 2 months' time, that means lesser number of deaths. But why we are relaxing right now is because we cannot shut down all time. Someday we have to peak. Well, if we extended the lockdown up to 70 is what the recommendation by the ICMR is. If you extend up to 60-70 days of lockdown, the peak numbers will be lower. But beyond that, I don't think it does any benefit to, in terms of bringing down the peak, because anyways, we all will have coronavirus eventually. We just don't want to have coronavirus right now. We will get coronavirus sometime when there is more number of people who are infected, and that is a better way to get infected, because the more number of people get infected, develops herd immunity, and we are more safer, and the virus strains are much weaker in the later part of this pandemic rather than the earlier part of the pandemic. So that's probably the reason. I hope it has explained to you in bits, but then, in a pandemic, as I said, there is no best answer for any good question. Moving on from there, the next question is by Mrs. Suma Banerjee again. She says, will the temperature sensing device help? If so, how often should the temperature be measured? Ma'am, see, what we are doing in our hospital is we are checking temperature of any person who comes in morning, or any person who comes in the afternoon. Any new entry into the hospital, they are checking the temperature. It may not be the best measure, but something is better than nothing. Yes, temperature testing, because if you at least have somebody who is with fever, you can just quarantine them then and there. Well, further investigations can be carried on later to say if it is or not, but I suppose there is no easier way to do it. And I think one temperature recording in a day should be more than sufficient to rule out, or to at least catch early the presentation of any influenza or COVID child in your school, right? So we certainly don't check temperatures when people are leaving the hospital, but we do check once when they come to the hospital, right? I suppose the last few questions now. Nabila Ahmed is, sir, we have heard that due to mutation, there are no specific symptoms. So what are the symptoms now that we can be related? See, in general, there have been various symptoms reported from various parts of the world. So what Ms. Nabila Ahmed is asking is, due to the mutation, there is a variety of presentations that the coronavirus is presenting with. What symptoms should you watch out for? If I understand your question right, Ms. Nabila, the basic symptoms, I have just said it a couple of times, I'll repeat it for you, is fever, shortness of breath. Okay, this is the two things you should go to a hospital in an older person. Children do not have asymptomatic characters. And there have been reported cases of throat pain, there have been reported cases of stomach pain, there have been reported cases of having dizziness and those kind of things. But those are all not to be, because any disease spell could be, or any stomach pain would turn out to be COVID. So I would not encourage you to believe that every symptom is because of COVID. But yes, primarily if you have fever, if you have cough, if you have shortness of breath, you are likely to be in that category, but you could be having influenza. I would just ignore any other presentation that is coming for us right now, because it'll scare us and send a panic wave to everyone around. Because any symptom, headache, it happened in Bombay. There was a person who, one of the celebrities, I suppose, he happened to present with a headache. He went to the hospital, they tested him for COVID. COVID came positive. Now people say headache is a symptom of COVID. No, I think COVID headache could have been a coincidence, and headache was due to any other reason, but COVID happened. He probably had COVID, so headache may not necessarily be a symptom of COVID. But these are early days, ma'am. We still don't have much data to say what exactly. But yes, we now know in the last 60 days or 3 months or 4 months, yes, if you have fever, cough, breathing difficulty, heaviness in the chest, you could be having, it is not 100%, but you could be having something else also. The best way to do is go to the hospital, get your test done for COVID. Right, okay. I think I've addressed most of the questions. Joydeep Chakraborty is asking me, what is an inactive patient? Inactive patient could be a patient um, who has COVID and has no symptoms, or an inactive. Oh, sorry, what is an active patient? Sorry. What is an active patient? I think that is the same answer that I gave to Ms. Nabila Ahmed, Joydeep sir, uh, is uh, is the same answer that, active patient is the one who has fever, who has shortness of breath, who may have throat pain, and who may be coughing, or who may just feel very heavy in the chest. And you do a test, he comes positive, he is an active patient. So that patient, yes, needs medical help and isolation. The question is by Devi Kandaswamy. Sorry, ma'am, if I've got your name pronounced wrong, my apologies. The early symptoms to identify if I'm suffering from COVID-19. This again, the repeat the same thing which I gave to Joydeep Chakraborty ji and Nabila ji. It's the same question. David is like, you have to uh, look for cough, fever, and shortness of breath. Difference between COVID and influenza, I've answered that. 6 feet is mandatory, is it not? So this is a question by Mrs. Madhuri Rao who left. She asked me, good afternoon, sir. Distance of 6 feet is mandatory. It's not maintained. How to take precaution if it's not maintained? See, ma'am, this distance of 6 feet is absolutely mandatory. If you can't do 6, at least do 3. Well, as I sadly said, in our population, it's difficult because people, in spite of the number of times that they have been told to at least maintain 3 feet to 4 feet, it's not possibly happening. So the only way, I suppose, is schools educating children taking the message back home, and that's the way I have seen it work in my clinic. And teachers have the biggest responsibility uh, in this, I suppose, and schools are the ones who are going to change the future of the world, because you teach them and they change the future, because they are the future of the world. So if you can't maintain 6 feet, not even 3 feet, at least try wearing your mask, keeping your hands to yourself. Don't repeatedly touch your face and nose. Open the doors with your elbows. That's about it. So I think I've covered all the questions. I'm sorry if there were so many of them. I may not have had the best of information available, but the main idea was to collaborate, Rainbow and DPS Secunderabad, and see how we go forward. If you need any help, we are open. There are a few things that I'll get sent across. One is how to dispose the masks, uh, you know, our recycling processes. And then the second thing is I will send forward the guidelines set by WHO and International Federation of Red Cross. I think we should collaborate. And then if you need to address parents, I think we could come on board with you to talk to them in partnership, and maybe you could set up a committee, a COVID committee in school, or a few teachers um, whom we can interact with, whom we can to be in contact with, so that any issues relating to COVID, and as the school has information, we are able to coordinate with you, and the parents are reassured that the school is uh, in tie-up with Rainbow to provide better, safer healthcare to their kids. So, ma'am, Shailaja, ma'am, it's up to you to think as to how you want us to, be with you in this journey of reopening schools. This is a little odd. I've not done this kind of thing where I'm sitting here and talking to a computer. Uh, you know, that, but whatever the little that we could do, I think we will. Next time, I suppose we should probably meet in person, ma'am. Maybe we could have a better bilateral conversation. because here it's so difficult to communicate on this platform because I'm not experienced on this. The last thing, thank you once again, everyone, for I've taken an entire hour of yours on this. I hope I could answer most questions. But before you open the school, maybe we could do one personal meeting in the school when only the teachers are there, and then have certain guidelines proposed, and then circulate back to parents. And that's how I would suggest we could go. If there's anything, ma'am, I must have skipped, I'm sorry about it. If there are certain things I may not have had information on, which I will get back to you on in print with that, right? So good luck, stay safe, and hopefully we will get through this together in the future, right? Okay.